Hi everyone, we're live. Welcome to Talking Live with Mei Sze. For those of you who are tuning in, thank you so much for staying tuned almost every bi-weekly Sundays. So the same call to action to all of you. Today's topic is very close to my heart, very important in particular because it's something I'm going through as well, fertility, and I want to make it more mainstream. So please share this with your friends, with your relatives, so that they can come in to join in to discuss, ask questions, and not be afraid, not be embarrassed to discuss something like fertility or rather infertility. So please stay tuned, join us for the stream right now, and more importantly, share this out. Share this with your friends, with your relatives, so we can get more people talking about it. We have an expert here for all of you to ask questions. So if you have a WhatsApp chat group, that would be great. You can share this with them. If you know someone who is going through an infertility issue, this would be a good avenue for you to share this with them as well. I want more people to join us to talk about this topic, make it more mainstream. I do hope you can bring this up in your chat groups or in Facebook or Instagram. Share this link out so that they can ask questions. Hi everyone, welcome to Talking Life with Mei Sze. This is a bi-weekly show where we talk about health, wellness, and trending topics. I'm so happy to see all of you coming in, staying tuned, and more importantly, we're going to have a Q&A session for you to ask questions. So please go ahead, type your questions in. And if you're wondering what today's topic is about, before that, of course, happy Malaysia Day to all Malaysians celebrating. And for those of you who are not from Malaysia and from other countries, it is quite a long weekend here in Malaysia. So for those of you who are actually out and about, remember to practice the SOPs. Focusing on today's topic, we're going to talk about cancer and how it affects fertility. But beforehand, I would like to talk about fertility as a whole. This is the theme for the month. The reason why I actually put it up as a topic is because I am going through some fertility challenges of my own, and I felt that it should be more mainstream. A lot of people, males and females alike, are afraid to talk about it, or rather they're embarrassed to talk about infertility. And the thing is, infertility is on a rise in Malaysia and in a lot of Asian countries. But there's a stigma attached to it. And that shouldn't be the case because I have friends coming to me to ask me questions like, I heard, where do I seek help? Which doctor should I go to? Which hospital? And they have so many questions, but they have nowhere to access this type of information. And that's why I'm narrowing down, focusing on fertility for this whole month of September. The first episode was on a lymphoma survivor and how she has a beautiful boy now. And this second episode is with an expert to talk more and ask questions, to discuss further, and focusing on cancer and how it affects fertility. So as a cancer survivor myself, my experience is pretty interesting because I remember when I had cancer at 27, my team of doctors, there was a rumor that I was going to get married. So a lot of them kept asking me, I heard you're getting married. I heard you're getting married. But actually, I wasn't even proposed to yet. So my dad apparently told one of the doctors that I'm going to get married soon, but that wasn't the case. So I would laugh it off. But a few years later, I found out that actually they were asking me those questions because of the fact that if I were to get married at that point of time, getting a child wouldn't be easy. So now I know why. And that's why I feel that for cancer patients of reproductive age or those newlyweds or going to get married, doctors should talk to their patients about fertility before proceeding with treatment. Of course, a lot of them present at later stages, which is stage 3 and 4. So it's the main aim is to save the patient's lives. But if we were told about fertility, at least we get more options. So these are the things that we're going to talk about today. And today we have an expert, like I mentioned. He is an obstetrician and gynecologist, as well as a fertility specialist at TMC Fertility in Puchong. He has worked in several major hospitals, such as Hospital Malacca, UMMC, Hospital Sungai Buloh, and for his commitment in ONG, he received an Excellence in Service Award from the Selangor State Health Agency in 2009. So before I introduce Dr. Chong once again to take over the questions. Please share this with your friends, relatives who are going through infertility issues. We have Dr. Chong Kuoh Ren from TMC Fertility in Puchong. Hi, doctor.
Hello, hi, Maisie. Thanks for having me. Yeah, good evening, everybody. I hope you guys are well.
Yes, I hope so too. Thanks, Dr. Chong, for joining us. I think I'll jump straight into the questions because I think people already have questions. So,
Yep.
Dr. Chong, my first question for you is when a female has cancer at reproductive ages, the thing that is most often not discussed is fertility. So, what are your thoughts on that, Dr. Chong?
Okay, and so as you mentioned earlier, I think in hindsight, people who have survived cancer, they do, they ask how come the doctors, didn't tell me this, didn't tell me that. So I'm going to just let you know, probably from the doctor's viewpoint, what goes through our mind. Every time we have to break bad news to the patient. Okay, so the first priority for the doctors, of course, is to manage the cancer diagnosis. That itself, it's a big topic. It has a lot of information to cover. First, we have to break down, the stage of cancer. Maybe we need to do further testing, some CT scans. Some of them are quite invasive. Next, of course, will be the treatment itself, like chemotherapy, radiotherapy. Sometimes surgery may be needed, and all of these are very technical and a lot of details. So the risk of information overload is definitely there. So discussion of fertility probably is not the main priority, in the first sitting, especially if it's a very advanced stage cancer. And especially if we don't think the prognosis is good, then we may not want to stress the lady out, by talking about kids and, growing up, future 5 years later, 10 years later, But of course, with advancement in the treatment for cancer, the survival rates are getting better and better. And, some of them do recover from cancer. And, after some time, fertility is the next thing on their mind. Yeah. So, of course, if possible, I would also like to remind my cancer colleagues who deal with cancer patients to just sort of pop in a little bit, about fertility issues.
I mean, from a cancer survivor perspective, I feel that it should be discussed. Maybe
Okay.
because I'm more of an early stage cancer patient at a point of time. But what if I was truly going to get married, and I was planning for a child at that point of time? But I do hope that, and also for a lot of my friends who are cancer patients and survivors now, a lot of them actually are going through treatment, and they too actually kind of know that it takes like a while to actually be able to get a child. So this is something that I feel that should be discussed or at least highlighted before treatment begins. So my next question for you, Dr. Chong, is usually a female can only start trying for a child after 2 years of chemo and radiotherapy. Why is that so?
Okay, there are a few reasons. Number one, what we're worried is whether the cancer treatment is effective or not. So the cancer, sometimes what we have is after the cancer treatment, after surgery, after chemotherapy, we are worried that the cancer may pop back up again or regrow again, or what we call recurrence. So the longer the interval between treatment and coming back, of course, the better the survival rate is. So if 6 months cancer-free, 1 year cancer-free, 2 years, no signs of the cancer coming back, then we're more confident that the treatment was successful. Okay, in a certain type of treatment, for example, for thyroid, or some chemotherapy, the drug that is used to treat the cancer has a long washout period, meaning some of this medication may stay in the body for a long time, and these may be harmful for the pregnancy if the lady do get pregnant. Yeah, so we need to make sure that whatever treatment is out of the system before trying to get pregnant.
I see.
Yeah.
Okay. Um, so the next question then it will lead me to is what are the chances for those of us who have had cancer to get pregnant naturally?
Well, the chances, of course, depends on individual ladies. If the lady is pretty young, meaning less than 35 years old, and it also depends on the type of cancer. If it's not related to the womb, not related to the reproductive system, example thyroid or brain tumor or skin cancer, and maybe even lymphoma, okay, where the treatment will not involve hormones, okay, then the chances are pretty good. Okay, now sometimes if the cancer is very aggressive, and likewise the treatment for cancer also is pretty aggressive, and some of the chemotherapy, they do have side effects. Okay, they may harm the heart, they may hurt the lung, or they may harm the kidneys permanently. Okay, so if these ladies go on and get pregnant, because their organs are not functioning very well, the pregnancy itself may push the organs to their limits. So the side effect of the chemotherapy may actually make it harmful for the women themselves to get pregnant.
So this, basically, these type of cancers are your breast cancers, endometrial cancer, and ovarian cancer.
Oh, okay. So what I was mentioning earlier, meaning the chemotherapy itself affects the heart, okay, or affects the lungs, or maybe it does scarring to the lungs. And if somebody, after chemotherapy has 20% lung damage due to the chemo, if they're not pregnant, they're okay. But once they get pregnant, then the demands on pregnancy is actually much higher on the lungs and on the kidneys. So you have to make sure you're healthy enough to embark on a pregnancy first before deciding to get pregnant. Yeah. So that's one of the side effects of the chemo. Now, if you're talking about the type of cancer, for example, breast cancer, endometrial cancer, ovarian cancer, all these cancers, unfortunately, may worsen whenever we start any hormonal treatment. Okay,
See.
so yeah, so fertility treatment, it's all about hormones. So what we're worried is if the cancer cells, one single cell is hiding somewhere, even after 2 to 3 years, when we start on fertility treatment, which involves hormones, and this may trigger or encourage all the cancer cells to grow back. So that's our worry.
Okay. So I think that's actually good to know for a lot of the breast cancer patients and endometrial and ovarian cancer patients. So what other options then are there for cancer survivors who can't get pregnant naturally?
Okay, if if their egg supply is pretty good after our assessment, then they can try some mild forms of fertility treatment. Mild forms of fertility treatment includes fertility pills. Okay, they can get pills like clomiphene, letrozole, which encourages more eggs to grow per month. This will hasten the speed of getting pregnant. And if the partner's sperms are not very good, okay, sometimes the husband's sperms are not very good anyway, we can try things like intrauterine insemination or IUI. Now, if the eggs are really not so great at all, or the husband has sperm problems, we can even do IVF. Okay, IVF is a bit more aggressive, whereby the lady has to undergo about 10 to 12 days of injections. These injections encourage about 10 to 15 eggs to mature, and then we do a procedure to remove the eggs, and we mix the egg and the sperm together in our fertility lab. Okay, after observing for 5 days, we will choose the best growing embryos and decide which ones to put back into the womb. The added advantage of IVF is if we have extra embryos, then we can freeze them for later use. So example, we may end up with 4 or 5 very healthy embryos, but of course we put one by one back. And so the remaining 4 embryos, 5 embryos, we can keep it as a backup for later.
Okay. So the question then would be if the lady doesn't have a uterus and no functioning ovaries, um, is are egg donors allowed in Malaysia?
Okay, egg donors, if their own eggs have exhausted, or maybe she had an ovarian cancer and both ovaries are removed, but her womb is still intact. Okay, then the lady has an option of getting a egg donor. Okay, egg donor is allowed in Malaysia, or more precisely, there is no law against donating your eggs. Okay, so egg donor has been going on for almost 15 years, 20 years in Malaysia already.
I
Okay,
see.
so I've
Okay.
handled many egg donor cases, and with egg donor, it's actually the outcome is actually pretty good.
Okay. What about if the person doesn't have a uterus?
Okay, without a uterus, then it gets very difficult. Okay, because without a womb, then it's almost impossible to carry the womb. So the only option is to get a surrogate mother to carry the pregnancy for you. In Malaysia, again, there is no law saying against surrogacy, unlike in the States or Hollywood, uh, other Asian
Yeah,
countries, whereby surrogacy is allowed. Malaysia, we tend to have quite a not very good experience with surrogacy. Yeah, the reason is mainly number one, in Malaysia, if a surrogate delivers the baby, by law the baby belongs to the surrogate. Okay, so to transfer over the care of the baby, it has to be sort of like an adoption. Yeah? So the surrogate delivers the baby, then you need to go to court and
I
uh,
see.
get the lawyers
So
to
it's not legalized.
it's
Okay.
uh, it's not easy. Okay, and the second thing is to get a reliable surrogate. It's not easy in Malaysia. Yeah, because surrogates also they face the risk of pregnancy especially do carry some risks.
Okay. Thanks for sharing more about other options available, Dr. Chong. So, would you advise cancer patients then to freeze their eggs first?
Oh yes, definitely. Egg freezing is no longer experimental. Okay, initially about 10 years ago when egg freezing started becoming available, people think it's something experimental, something from science fiction. Yeah, but it's been around for almost 10 years already, and we are getting good pregnancy rates with egg freezing. Okay, it's almost similar the pregnancy rates to IVF, right?
That's
You need,
really
yeah,
good.
yeah. So the technical part about egg freezing is, let's say the diagnosis of cancer is there. Okay, the process of egg freezing takes at least 10 to 12 days. Okay, so we need that time to stimulate the eggs with some injections, and after 10 to 12 days, we need to go undergo about a 30 minutes procedure to remove the eggs. So if the cancer treatment it's not that serious, or we can spare 12 days to get the eggs out, then egg freezing is definitely an option.
That's good to hear. I mean, not just for cancer patients, just for any females out there or males out there who are having issues with their eggs or their sperms. I think egg freezing, sperm freezing should be they should consider it,
Yep,
especially at
definitely.
younger ages when they have more eggs and things like that. So the next question then is, what's the success rate of IVF for cancer survivors?
Okay, so the success rate of cancer survivors is it's almost similar to non-cancer survivors. Okay, especially if they are younger than 35 years of age. Of course, the initial assessment would be of to check whether the eggs that the lady has is good, or the eggs that she has is less. And the other thing is also anything wrong with the womb. Does she have the intact womb? Does she has an intact cervix? But we still have to go through the initial assessment for IVF and non-IVF patients. If the eggs are good, if the womb is intact, if she's young, fairly young, about 35 and below, we are looking at about 50-60% success rates.
That's actually very good. 50 to 60%. I mean, those type of rates are really, really good. I think that's very, very important and good to hear for a lot of female cancer patients and survivors out there. So once again, to all of you staying tuned, watching this, if you have, friends, relatives facing infertility issues, please go ahead, share this video with them because we're going to move on to our Q&A session in just a bit. So, Dr. Chong, I have another question for you then. What would be your advice for females of reproductive age who are first diagnosed with cancer? What should be the precedent?
Okay. Number one, of course, is to prioritize the cancer treatment. Okay. So don't hold back any proven treatment to treat the cancer and to save your life just because you want to have a child in the future. Okay. The present is more important. Your current partner, your family, your husband, okay, is more important. Okay. So number one, prioritize your treatment. Of course, number two, you have to realize, especially if the cancer is quite a serious one, if you do get pregnant soon, okay, the baby may grow up with only one parent a few days later. Okay, so not to sound morbid, but this is something we may have to consider. Okay, especially if the cancer treatment is not complete or the cancer, comes back again. Now, number three is you need to need to understand the side effect of the cancer treatment, especially on the negative effects on your fertility. So this you have to discuss with your cancer doctor as well. Number four, if you do have the time, then of course try to get a consultation with a fertility doctor earlier, before you start the cancer treatment, rather than 4 or 5 years later down the line. So you can consult the doctor and you can see what options are available to you.
Okay, so that's for females. What about males?
Okay, for males, it's actually pretty straightforward because sperm freezing, the option is there. It takes maybe 1 or 2 hours. We just need a sample of the sperm. We check the sperm is good, then we can freeze the sperms for later use. Okay, so the sperms probably sputum sperm will be useful for an IVF later down the line. Okay, but it's very easy. It's 1 or 2 hours trip to the fertility clinic. That's it.
So men have it easier.
Unfortunately, yes, men has it very easy.
They don't have to inject hormones in their bodies and
But provided if the sperms are good in the first place.
okay. Thanks a lot, Dr. Chong, for answering all of my questions.
Sure.
Now, we're going to take questions from the audience. So, hi, everyone. For those of you who are joining us and who have joined us so far, thank you so much. I see all of you saying hi. Some were saying hi back. I'll take Samuel's question first. Um, Interesting question. I'll start with the second question, Samuel. What is the sign of cancer? No. What? How is cancer related to fertility?
Okay, so cancer-related fertility for both men and women, cancer treatment depends on the cancer types. Okay, some will just require surgery, and that's it. Okay, we can cut out the cancerous part of the body. But the thing about cancer cells is that the cancer cells like to spread. Okay, they can either spread locally, meaning they spread to the neighboring organs, neighboring tissues, or they go through your blood or go through the lymph nodes and spread to other parts of the body. So to prevent the cells from spreading to other parts of the body, we need to give chemotherapy. Okay, so chemotherapy well, you can say it's almost like a poison that we put in the body to target rapidly developing cells. Okay, so cancer cells, they grow very fast. So we target cells that grow very fast. So we will in hopes to wipe out the cancer cells. So other parts of the body which has a similar property, they grow very fast. For example, hair follicles grow very fast, eggs grow very fast, the mucus lining in the intestine grows very fast. So all these tissue will also have the side effects. So that's why a lot of cancer treatment patients, they start to lose their hair, they go bald, they have diarrhea. Okay, so the cancer treatment itself is actually harming the testes, is actually harming the ovaries. So that's why it's not the cancer itself; it's the treatment for cancer. Okay. Now, if the cancer affects the reproductive organs, if it affects the testis, okay, then unfortunately we have to remove one part of the testis. Okay, if it involves the ovaries, then we very likely have to remove one part of the ovary. So that in turn also reduce the fertility chances.
Okay. The next question from William. He's from Indonesia. So he asked how to increase chances of fertility.
Okay, chances in fertility in general, I'm not sure whether it's talking about after cancer or in general. In general, then of course, healthy lifestyle is the most important. Okay, make sure you have enough rest, do some exercises, stay away from cigarette smoking, stay away from alcohol. Okay, take some supplements, do a bit of exercise. Supplements, what are we talking about? We're talking about antioxidants like vitamin A, C, E. You can take some omega or fish oil to improve the blood circulation to the body. If you have medical diseases, make sure you sort them out. Okay. If you have high blood pressure, if you have high cholesterol, you have diabetes, all these you need to get them under control. So the ovaries and the testes, they are part of your body. So they are actually an important part of your organs, right? So if the body is not healthy, then the nutrition to the ovary, the nutrition to the ovaries are not good. So this will also reflect in the ability of the women or the men to get pregnant. Okay, so number one, take care of body. When your body gets healthier, your fertility chances also increases.
And he asked whether there's any type of medicine to get children.
Well, there was a question I think about getting a boy or a girl. Uh,
Yeah.
Probably he's talking about gender selection. So gender selection in fertility treatment, we are able to sort of select the gender via IVF. Okay, it's a extended part of the IVF. We call it a third generation IVF, whereby we do IVF, we get the eggs out, we wedge with the husband's sperm, we observe the embryos to day 5, and we take a small sample from the embryo. Okay, the purpose of the sample, the biopsy, is to check the DNA of the embryo, whether it's a healthy baby, whether there are any chromosome problems like Down syndrome, Edwards syndrome. And the bonus tip about this test is we look at all the chromosomes, so we are able to find out whether it's a healthy boy or a healthy girl. Okay, so let's say we test 5 embryos, we have 2 healthy, 2 unhealthy. The remaining 2, then we know whether it's a boy or girl. Okay, then from there, then we can sort of choose which embryo to put in as a priority.
I see. Okay. So that's good news. You can choose gender selection through IVF. I'll continue on with the next question from Cousin Hui. If patient has only done radiotherapy, not chemotherapy, will it still affect fertility? And the radiotherapy is not done at the lower abdomen area.
Okay, so if it's a radiotherapy apart from the lower abdomen area, then it's probably unlikely to injure the reproductive organs. Okay, but of course, if you are getting slightly older, it would be best to check with your gynae or your fertility doctor to look at your fertility potential. Okay, we can do ultrasound
Yeah.
scans to have a look at the eggs. We want to see how many eggs are left. We can do some blood tests, some hormonal blood tests, for example, FSH or AMH, to look at the quality of the eggs that are left. We want to look at the quantity of the eggs that are left. Okay, there are some tests that we can be done, blood tests or ultrasound scan.
Okay.
Okay.
So I think it's good advice to actually seek more further assessments from your doctor. So Eric asks, women must plan ahead if they intend to have a family and ensure adequately to take care of all financial matters from treatment to lifestyle adjustment. What are your experiences with your patients, Dr. Chong?
Well, I think it's probably the question is talking about financial part, if I'm not mistaken. So unfortunately, in a developed country like us, okay, a lot of us, we postpone getting pregnant, we postpone starting a family until we are more financially secure. Okay, I think that's some rumor going around. To raise a child, you need 1 million ringgit in your bank, okay, before you start planning to a family. So, uh, well, unfortunately, because of this, a lot of people, they tend to make sure they have a lot of money first before they start getting pregnant or before they even contemplate in starting marriage. Well, from a fertility point of view, money, I think, is important, but you can make money later. Okay, the important thing is if you have plans for starting a family, your eggs, the biological clock is ticking. Yeah, so you have to prioritize whether you want to start a family or get a financial security. So people who are financially more secure, but unfortunately the age catches up, okay, and the biological clock is halfway gone already. And so if you have money, but the eggs that are left are not very good, then you unfortunately will have problems getting pregnant.
Okay. So I hope that answers your question, Eric. Tang Man Hoi asks, cancer treatment can affect fertility even after the treatment has stopped?
Yes. So if the cancer, probably we mentioned, has injured the
Yeah.
ovary, yeah. So let's say before the cancer treatment, you have 80% of your eggs. Okay. After the cancer treatment, maybe half the eggs are left. Okay. So the quantity of the eggs go down, and we have to remember as we age, the quality of the eggs also drops. Okay, starts dropping. Yeah, so even after the cancer is cured, even after the chemo has finished, 5 years later, amount of eggs that we have, that's all. For ladies, this is a bit unfortunate because a baby girl, when she's born, all the eggs that she'll ever have, it's limited. Okay, so the maximum is when you're 12 years old, when you start having your menses, that's the maximum number of eggs. Every month, as your menses comes, you're losing a little bit of eggs. So in teens, 20s, you're losing more and more, 30s, 40s, okay? And once women finish off their remaining eggs, so it goes down and down and out. There's no way to top up, it's not like fixed deposit you can top up later on. Okay, it's only going downhill. For men, well, men, fortunately, the testis still functions. At 80 years old, the sperm production is still going on. But of course, 80-year-old sperms are not so good, as compared to a 30-year-old sperm. So age also affects men, but not as much as women.
Okay. Thanks a lot, Dr. Chong, for giving us in a way, from zero to age, however, for females and males. I think that's important for us to know. So, Cousin has a follow up question. After stopping tamoxifen, how long do we need to wait before conceiving to ensure no defects to baby arising from the medication?
Okay, tamoxifen it's a treatment for for breast cancer. Okay, the advice is probably 2 years, maybe 3 years, up to 5 years. Okay, now tamoxifen, I can't remember what's the dose. I think it's either a daily dose or weekly dose. Okay, if it's a daily dose medication, it means the medication clears out of the system very fast. For example, Panadol, it lasts only for 3-4 hours. Okay, so it clears out the body very fast. So if the tamoxifen, if you're taking on a daily basis, means that it clears out for your body very fast. So probably after 2-3 months of stopping tamoxifen, after a checkup, then you can actually start trying already. If there are some medications, the dosage is every month. Okay, so it means that it stays in the body longer. Okay, so that means you have to wait probably half a year before trying. So it really depends on the type of anti-cancer medication you're on.
Okay. Thank you so much. I hope, Cousin, that answered your question. Eric had a question. How much does fertility treatment cost and how long is the treatment?
So fertility treatment, it's the range is quite large. If you're talking about simple things like fertility pills or fertility tablets, okay, the tablets are 5 ringgit each. So cost one month's cost is only 5 tablets. That's about 25 ringgit. Okay, so that's a fertility pill. Of course, there's the consultation and the scan fees that you pay. So each month for fertility pill, probably a few hundred ringgit. Okay, so if we move up to something like IUI, okay, IUI is when after fertility pills on the fertile period, we get the husband's sperms and concentrate it and choose the good ones and put it back into the womb. That's an IUI. The cost will be about 1,000 to 2,000 ringgit. Okay, something a bit more aggressive, something a bit more high tech would be IVF. So IVF, it's a bit more expensive. It's 15, 16,000 to 20,000. If you add on things like testing the DNA, a few other things, then it may go up to 20, even 30,000 plus. Okay, we have, it's a bit like Air Asia. Okay, you buy a normal one. To improve the rates, we apply more technology. It will increase the chances, but of course the cost goes higher and higher up a bit.
All right. Thanks, Dr. Chong, for answering Eric's question. I agree with you in terms of paying more, and then, we increase the chances as well. So I will take two questions, I believe, our two last questions. So William Tan asked, as we know, we have stage 1, 2, 3, and 4 in cancer. Do you encourage cancer patients above stage 3 to get fertility treatment? What do you suggest and what's your opinion?
Okay, so if it's stage 3, stage 4, that means the cancer is actually pretty advanced. And for doctors, it's difficult to say how many. We are talking about survival rates. Okay, so we are realistically talking about after 5 years or after 10 years, how many stage 3 cancer patients are still around. Okay, so the situation is our fertility treatment can help you get pregnant. Okay, and you may manage to conceive, and the baby boy is out, or your baby's out. But you have to realize that anytime after delivery, when the baby is 3 years old, 5 years old, the cancer may come back again. Okay, so there's no way to predict whether the treatment is successful or not, especially if it's a stage 3, stage 4 cancer. And if that happens, then the possibility of the child growing up with only one parent left, it's there. The doctors, we can't make the decision for you. It's between you and your future partner, and what's right to move forward. Okay, because taking care of kids is not easy. Okay, I have 2 kids, 2 sons, and it's not difficult. They're not easy at all. Okay, so more, even you imagine if one parent bringing up the child. Okay, you need support system. You need to arrange for later on who's going to take care of the child. You have to have your support system, your in-laws, your parents. So there's a lot of things to think about.
Okay, the last question is from Kazin again. Her doctor advised her 2 years of hormonal therapy, and then she can try conceiving, then continue back on hormone treatment. Is it possible to have 2 pregnancies instead before we resume hormone therapy? I like that question.
So I suspect you're talking about whether getting twins is a good idea or not. Okay, so one shot, get 2 babies out, okay, then continue. Twin pregnancies in general, it's higher risk than a single pregnancy. Okay, if you get a twin pregnancy, the risks, it's 9 times higher than if you are carrying one baby. Okay, so why is it 9 times higher? When twin pregnancy, the risk of early or premature delivery is much higher. So meaning the baby, before it reaches 8 months, maybe 6 or 7 months, the baby wants to come out. Okay, because the tummy, the womb can't handle 2 babies, especially if this is a first-time pregnancy.
She added on that she's not mentioning twin pregnancy, so maybe like one after another. That means get 2 different children before going back, resuming hormonal treatment.
Okay, so probably within the first 3 months, get pregnant. Okay, pregnancy is 9 months. Okay, so after delivery, for the body to fully recover from the pregnancy, we were advised to rest for at least a year. Okay, so that's 1 year plus 2 years. Then you want to get pregnant again, there'll be a 3rd year. So it'll be 3 years, of no treatment from cancer. So whether that 3 years interval, is it safe to be off of any anti-cancer treatment? That you have to discuss with your oncologist to see whether it's, is it a risk worth taking or not taking.
Yeah, I agree. I hope that answered your question, Kazin, on your fertility journey, trying to conceive. Good luck to you. So thanks a lot, Dr. Chong. For all of the audience, if you have more questions, please check out TMC Fertility on Puchong. I think they've put in their care line or their WhatsApp number where you can continue to ask your questions. And they'll be more than happy to assist you, or you can even check out their website. So please go ahead and do so. And also, as Dr. Chong is from TMC Fertility at Puchong, they are also having an egg freezing package of 8,888 ringgit. I think it's on the ticker below, that has been running for the entire session. An egg freezing package with 3 years of maintenance and also consultation with doctors and also ultrasound. So 3 years of free freezing maintenance, laboratory and OT charges as well. So please check them out if you're interested in egg freezing, and they also have the sperm freezing. This promotion lasts till 31st of December 2021. So for those of you who are going through your fertility journey, good luck to all of you, and we wish you all the best. And thank you so much, Dr. Chong, for joining us on today's Talking Live with Mei Sze. Deep diving into fertility and cancer with us. There's so many things that we can discuss, and I'm glad all of you had questions for Dr. Chong. Thanks a lot, Dr. Chong, for joining us once again. Have a great day ahead, everyone. Bye.